Hi, my name is Arin McCarty. I'm a nurse practitioner student with Auburn University. I'm going to be doing a head-to-toe assessment on you today. If you could just state your name and date of birth for me.
Peggy Ferry. My birthday is October 8th, 1945.
Okay. And where are you from, or where are you at right now?
Butler, Alabama.
Okay. Patient's alert and oriented ×3. Voice is clear. There's no slurred speech. She's able to articulate words appropriately. She's well dressed for the season. Muscle mass appears normal. The skin is appropriate for her ethnicity. Next, I would move on to her scalp. There's no nits anywhere. Hair is clean, well groomed. Scalp is symmetrical. No signs of swelling or edema. No bony abnormalities, any tenderness there at all?
No.
No. Okay. Next, we'll move on to her frontal sinuses. Any tenderness here?
No.
Any tenderness here in the maxillary sinuses?
No.
Okay. Also palpate your lymph nodes, periauricular, posterior auricular, occipital, tonsillary, submandibular, and submental, anterior cervical, posterior cervical, and your supraclavicular. Any tenderness anywhere there?
No.
Okay. And if you could just clench your jaw shut for me. Okay, assessing for TMJ. Just able to clench your jaw. It's cranial nerve 5. The trigeminal nerve is intact. Okay, you can stop. Next, we'll move on to her eyes. Eyes are symmetrical on the head. I would note her sclera and conjunctiva are intact. Here's normal. And if you could follow my finger for me. Okay, cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, abducens are intact. Next, I will grab my lights. And I'll grab my Snellen chart as well. And if you could hold that in front of you and read the last sign that you can.
LTF FH.
All right. So cranial nerve 2, optic nerve is intact. And if you could cover your right eye for me. Okay, and just let me know when you can see my hand.
Yes.
Okay, consultation test is normal. I'll grab my lights. Okay. We'll shine it right here. Pupils are equally reactive to light, and then I will shine it. The light reflects off of both eyes equally as well. I'll also do the red reflex test. Normally I would dim the room, but for the purpose of the video, I will not. Just look straight ahead for me. Here I'm assessing for the red light, the optic nerve, the fovea contralis, and the mouse. Intact. Next, we'll move on to your ears. We'll assess the trachea and the pinna. They're both intact. The ears are symmetrical. I will grab the lights. Look inside her ears. I'm looking for the conal light, bony labyrinth, and then the tympanic membrane is pearly gray. All appears normal. Next, we'll move on to the whisper test. I'm going to cover this ear and just repeat after me.
Cat.
Cranial nerve 8, the auditory nerve is intact. Next, move on to the Weber test. Just let me know if you can hear this in both ears, okay?
Yes.
Next, we'll move on to the Ryan test. Just let me know when you can't hear it anymore.
No.
Okay, let me know when you can't hear it.
No.
Okay, got good conduction in both ears. Next, we'll move on to your nose. If you could close one nostril for me, sniff. Close the other nostril, and sniff. Have a patent airway. Grab the light one more time. Look inside your nose. Any abnormalities there. And no abnormalities there. The nose appears symmetrical and midline, no deviations noted. If you could close your eyes for me. And then just let me know what you smell.
Alcohol.
Okay. Cranial nerve 1, olfactory nerve is intact. You can open your eyes again. Next, I will move on to your mouth. Open your mouth for me. Teeth are intact. Gums are intact. Mucous membranes are pink and moist. You can say ah for me. Okay, and here I would also do the gag reflex as well, but for this video I will not. That attests cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus nerve, and those would appear intact. If you could move your tongue up for me, move it down, side to side. All right, that attests cranial nerve 12, your hypoglossopharyngeal nerve is intact. Okay, next, can you push against my hand for me? With your neck. There you go. All right, and then push against my hand on this side. With your neck. There you go. Like that. All right. Perfect. Push against my hand. All right, if you shrug your shoulders. Okay, cranial nerve 11, accessory nerve is intact. We'll look at the neck as well. Neck is symmetrical, no swelling or edema. Trachea is midline as well. All right. I'm also going to assess for your thyroid. You just swallow for me. Okay, thyroid appears normal. Next, we'll move on to your cardiovascular system. We listen to the 5 points. So the aortic, pulmonic, Erb's point, tricuspid, and the mitral. Also listen with the bell musket. And the same 5 points, the aortic, pulmonic, tricuspid, Erb's point, tricuspid, and the mitral. While I'm doing the cardiovascular, I'm also going to listen to her carotids. Take a deep breath in for me. Okay, let it up. Another deep breath in for me. Okay, let it out. So at this time, I'll feel for carotid pulses. Just 3 plus on that side. 3 plus on that side. Also feel for radial pulses. 3 plus on that side. And 3 plus on that side. All right. Continuing on, we'll listen to the lungs. Deep breath in. Let it out. Take a deep breath for me. Good. One more time. One more time. Okay. Also listen posteriorly as well. Deep breath in. And deep breath in. Another deep breath. One more breath. Okay. Lung sounds are clear and equal bilaterally. Check for tactile fremitus. If you could say 99 every time I move my hands, okay? All right, go ahead.
99, 99, 99.
Okay, intact. We'll also check for equal chest expansion. Just take a deep breath for me. Okay, let it out. Even rise and fall in the chest. I would also check for her AP ratio. Just lift your hand up for me just a little bit. Appears 2 to 1. Okay, you can put it back down for me. Next, we'll move on to the musculoskeletal system. So I would check each joint here. Normally, I would have her partially undressed just so I could assess each joint appropriately. Also, I would check her skin at this time. It's warm, appears intact. I would also note for any scars, any abnormal moles, any different discolorations throughout the entire assessment as well. So, but any tenderness here?
No.
Okay, I don't feel any bony abnormalities. Next, you move on to the elbow. Any tenderness here?
No.
Don't feel any swelling or bony abnormalities. Any pain here?
No.
Okay, no swelling or bony abnormalities noted. Move on to the hand. Any pain here?
No.
No bony abnormalities, no signs of any swelling as well. All right, if you could lift your hand all the way up. Okay, extension. And then hyperextension, put your arm all the way behind your back. Perfect. All right, bring your elbow to your side here. Perfect. And if you can move your arm inward like this, outward. Okay, and then kind of move your shoulder up like a chicken wing, back down, abduction, adduction. Okay, you can flex and extend your elbow for me, back and forth. Okay, you could put your arm out, palm up, move it back down, pronate and supinate. Okay. You could hold your hand out, move your hand inward, outward. Okay. Flex and extend your hands for me. Okay. Any pain or swelling in any of those areas?
No.
Okay. Perfect. Next, text for reflexes. In a normal setting, I would kind of stand like this, just so you can see the video. I'll kind of stand like this at an angle. I'm going to check her bicep reflex. Normally I'll see a little bit of a twitch. If you turn your head to the left for me and close your eyes. Okay, just a slight twitch there. Next, we'll move on to her tricep reflex. Just a slight twitch there. Bicep radialis. All right, slight twitch there, and I would do this bilaterally as well. All right, look to your left for me one more time. Close your eyes. We'll assess for her patella reflex. Okay. Also assess for her Achilles reflex. And then test for the Babinski reflex. And no fanning there, so that's normal. On down here, I will check for her dorsalis pedis pulses, 3+. Posterior tibialis pulses, 3+. Skin is warm. Got good cap refill, less than 2 seconds. All right. Next, we'll move on to the neuro system. I'm gonna repeat 3 words. Just remember them, and I'll ask for them again later. Okay? Car, truck, and apple. You got it?
Yes.
Okay. If you were in the rain, what would you normally do?
Get an umbrella.
Okay, so the patient has great reasoning and judgment. Should we get out of the rain or get an umbrella? Next, we're going to move on to your fine motor skills. If you just go back and forth with your fingers like this for me. All right, patient's got good fine motor skills in their fingers. All right, if you could touch my finger with your finger, go to your nose and back. All right, keep going. Follow my finger with your nose. There you go. Keep going. All right, perfect. And then if you could have your heel, bring it to your knee, and then back down. Just glide your back and forth there. Okay, perfect. All right, one more test. It's kind of like patty cake. We're just going to go up and down. Go as fast as you can. Perfect. All right, if you could stand up for me, and then I'll have you just walk to the window here. Okay, patient has a normal gait, so if you turn around, if you could walk on your tiptoes if possible, and walk this way. Okay, that's perfect. Gait is normal as right there. I'm also going to test for the Romberg test. I'm going to stand behind you. You just close your eyes and balance best you can. All right, perfect. Okay, You can have a seat for me. Well, actually, hold on one more second. I'm gonna have you bend over. We'll assess your spine. Scoliosis noted. Spine is midline. No bony abnormalities noted. Okay, if you stand up for me, if you can bend backwards. Okay, bend side to side. Okay, twist you. Perfect. Okay, hold your arms out for me. Don't let me push down. Okay, don't let me push up. Don't let me push in. Don't let me push out. The patient's got good strength there. And also squeeze my hands. Perfect. Also have you have a seat on the couch now, please. You just lay back. Something I didn't mention while I was checking her cardiovascular system and listening, I would check for point of maximum impulse. I would just have her tilt over just a little bit, and I would feel right under the left clavicular line to like the fourth intercostal space. Another time, a good time to mention would be self-breast exams. For women, I would normally say do it the same time every month because the woman's normal cycle will differentiate your tests. I would have her do it in 2 different places, maybe once in the shower, either do it in a circular motion or an up and down motion, but do the same motion each time. Would also note for her to fill up towards her axilla to assess for any swollen lymph nodes there. And then lastly, I would also get her to tilt over just slightly and to see if her breasts are symmetrical and in the same shape. Next, we'll move on to cardiovascular again, and I would listen to the same points. Aortic, pulmonic, Erb's point, tricuspid, and the mitral. And I'll also listen to the bellum, that's good. Aortic, pulmonic, Erb's point, tricuspid, and the mitral. Okay. Also note if there is any pulsations. I do not see any. Next, I would inspect my abdomen first. And I would check for any peristalsis. I don't see any, and I would note any pulsations as well. I don't notice any there. I would listen to each quadrant of the abdomen, so all 4 quadrants. The patient has good bowel sounds. I would also listen to her aorta. And the renal. I would do this bilaterally. And the iliac. I would also do this bilaterally. And just for modesty purposes, I would also check for femoral pulses and for lymph nodes on each side, but I won't for this video. Next, I will move on to percussion. Listen for tympany. I don't want any hollow sounds. Next, I would do light palpation. Any tenderness?
No.
I would do deep palpation. tenderness in there at all?
No.
Okay. Next, I will palpate for the liver. Take a deep breath in for me. Okay, let it out. But also palpate for the splenic border. Take a deep breath in. Don't feel anything, so that's normal. Next, we'll move on to the bottom half as well, and I would also palpate for her kidneys. We'll do this on each side. Okay. Assess for hips. I would also have the patient degown for this, for the purpose of the video, will not. Any tenderness there?
No.
Okay. Any tenderness there?
No.
Ankles, any tenderness there?
No.
Any tenderness there?
No.
Okay. If you could lift your leg straight up in the air for me. Okay, you can let it back down. Perfect. Extend your knee for me. And let it back down. And extend it one more time up. And then you can rotate it out for me. Rotate it in. Okay, you can put it down. Put an ankle. Move your foot up for me. And then put it down like you're pressing on the gas. Roll it all around for me. Perfect. If you could flex and extend your toes for me. Alright. Here's normal. Okay. And you can sit up for me. And then have a seat right here on the chair for me. Two things that I did not mention. On the posterior side, I would also check for CVA tenderness. See if you, let me know if you have any pain.
No.
Any pain?
No.
Okay. One final thing for sterogenesis. If you could close your eyes for me, I'll have your palm. Just let me know what I draw in your hand. Let me know what you draw in your hand.
S.
Okay. And then one more thing. What do you feel?
Dime.
Okay. Awesome. All right. And then if you could tell me the 3 words that I repeated to you earlier.
Car, truck.
Be a fruit of some sort.
Apple.
All right. Short-term memory is partially intact. All right. Thank you. That's completion of my head-to-toe assessment.
Okay.